I'm Dr. Mike Milligan. I have a phenomenal treat for you right now. I'm here with Dr. Lloyd Rudy, a very famous cardiac surgeon. Lloyd, thank you so much for being with us.
You're welcome.
Dr. Rudy is the cardiac surgeon who discovered that it's a thrombus that causes ischemic events, the heart attacks and strokes. I'll get back to that in just a minute. But he also, in his talk yesterday at the AAOSH meeting, the American Academy for Oral Systemic Health, bringing dentists and physicians together, he said something that really blew me away. It was that of 1,000 heart valve replacements that he has done, all but one was related to a dental infection.
What I said was, in all of the heart valve replacements that were required in my patients,
right,
and in my partner's patients,
right,
I'm not talking about just me.
Yeah.
We were a group, and everybody was doing the heart valve replacements. But what I said was, in my experience, that having to replace a heart valve for infection, in my experience, was uniformly secondary to oral infections.
Okay.
To abscessed teeth.
Okay.
To dental caries, to infection in the mouth that then was transformed into the bloodstream and then infecting the heart valves.
Okay.
I'm not saying that we did 1,000 infected valves. That's a lot of infected valves.
Okay.
But in those people that required that, and also, even more important, in those people that we had replaced the valves already for rheumatic valvular heart disease and for degenerative heart disease and so on, when those prostheses, those valve prostheses that we put in got infected,
right,
that was a disaster because it's a foreign body.
Right.
And once you get an infected foreign body, that is a Dacron sewing ring or whatever, it's almost impossible to sterilize that valve with antibiotics.
Okay.
It's just a disastrous situation.
Okay. Right.
And so, and again, the connection between oral infection and the infection of their heart valves,
right,
was, in my experience, just almost uniform. It was not a cut on the leg that was infected, or a, an ear infection or something. It was, in my experience, almost all the time, an abscessed tooth or severe dental caries or periodontitis, just an awfully infected mouth.
Right.
And we, way back when we started doing this, we recognized this problem very soon and took measures to have these people have their dental problems fixed before we replaced the valve, if at all possible.
Right.
If it was
Right.
not an emergent operation
Right.
to fix this person's valve,
right,
first thing we did was look in the mouth.
yeah,
Way back,
Wow, that's-
I mean, the first valve
that's
replacement
fantastic, yeah.
was 1961.
yeah.
I was fortunate enough to scrub as a trainee, as a assistant resident, on the second successful valve replacement. That's how far back I go.
Okay.
Actually, I went further back than that, but no. But it very soon became clear that there was this incredible connection
Between the oral and the
between
and
the
heart.
oral, and so the cooperation between physician and dentist, for me,
Right.
has gone back 40 years.
Wow. Okay.
Really.
Yeah.
And I just insisted that the patient, when I saw him in the office, if that's where I saw him, go to his dentist, get his mouth cleaned up, put him on intravenous antibiotics, prior to his operation. I mean, just covering every aspect of this.
Right, right.
So that's why I'm so interested in being here.
Right.
That on top of the fact that I've recently learned, knowing that I've done these thousands of coronary bypass operations, and in every one of them you look at the diseased vessel and it's angry and red and inflamed. That arteriosclerosis is an inflammatory disease.
Right.
And we kept saying, wow, look at that. I mean, what's causing that? Why is it the body's reaction to the fat deposits getting into the blood vessel wall, or is it something else? And now we're learning
right.
that it's maybe the infection first.
In the mouth.
Yeah. Well, in the mouth or anywhere, but an inflammatory problem.
Right.
Chronic inflammatory problem, as well as the ranch diet and the smoking and the obesity and the metabolic syndrome and all the other things.
Right.
But probably the chronic inflammation is as important or more important than anything.
Right.
Really?
Predisposes to all of those problems.
Yeah.
Right.
We really did not know the exact mechanism of the sequence of events in a myocardial infarction,
Right.
which was taking millions of lives.
Right.
We had to do everything we could to not only fix these end-stage problems by doing bypass grafts and so on,
Right.
but how can we prevent this?
Right.
We knew way back we had to do preventive medicine. We still did not know the mechanism of the closure of the artery, did we?
That caused the heart attack.
I mean, we knew it was a fat deposit,
Right.
a cholesterol deposit, and so on in most instances, but we really didn't know the progression of events.
Right.
So one night at 2 o'clock in the morning, I'm doing a patient who had what we call a widowmaker, anterior descending coronary obstruction, with the whole front of his heart being in jeopardy.
Right.
We had to find out what it was going on in
Right.
there. And so we slipped a little catheter called a Fogarty catheter, very tiny little catheter up there, and then you blow up the balloon the size of the artery and you pull and see if there's a clot or not a clot or whatever.
Yeah.
So we did that. And out again, fortuitously, a perfect clot. I mean, the reason it was perfect was that an intact clot starts at a certain diameter and then slowly trails off into a tail.
Right. Right.
We're going to tell the world it is a clot, because here's a living patient, not postmortem, not here's a living patient having a myocardial infarction, and it was a clot that was doing it. Well, how'd the clot form and all that? Well, Brad Bale and Amy Doneen have shown that it's the exact mechanism of how that clot comes to be.
Right.
And so Marcus wrote it up and got it into the New England Journal of Medicine. Well, what was the impact of that? And all I can tell you is what a lot of cardiologists have told me.
Right.
Because I really didn't recognize this at the time until later, but what it told these guys was that if this guy comes in with his myocardial infarction, you give him something that'll dissolve that clot, and you can reverse that right then and there, an hour after this chest pain starts, or 15 minutes, or however close to the hospital he is.
Absolutely changed the thinking.
It really, throughout the planet.
Right. Just totally changed
everything. I mean, that's what I'm told, is that gave them the freedom to treat these people with clot busters.
Right.
It's very exciting to give somebody something in the vein and have his electrocardiogram normalize and his blood pressure start to come up and all the good things happening when that heart muscle goes, yeah, some more oxygen.
Yeah, you bet.
Huh?
You bet, absolutely.
Well, so we ended up then becoming very well known throughout the world. I mean, we gave talks.
Don't be so humble. You've been absolutely throughout the world.
We gave talks in South America and Europe, and I just had a wonderful experience giving a talk in Europe because I could look up and it was like the United Nations, because here's the Spanish guy and the Swiss guy and the German guy all mocking every word I said about that. And then I got back and Mike Wallace gets me on 60 Minutes.
Right.
You know what I mean?
Yeah.
So it's been a real run for me. Very exciting life.
You've saved so many lives and changed the way this has been treated, and it's fabulous. And thank you so much for all you've done.
Well, you're very welcome. It was just my job, right?
Well, thank you so much for being with us, Dr. Rudy, and for telling us these stories and the significance of the dental community involved with this, and then the history of how you came about to change the way hearts are looked at and the treatment of that.
Well, I think that this new society is going to help change things too.
Oh, absolutely.
Because it's going to be involved with the diabetes and the metabolic syndrome and the blood vessel disease and all that. And if we can get that improved by dental, by cooperating with the dentists and so on, even more than in the past, then we got, because I personally believe, and I got to stick this in this, put it in, cut it, whatever you want to do, but I firmly believe that the future of medicine has got to be prevention. And that's what I think we're doing here. We are going broke taking care of the end-stage disease. As much as that's been my job.
That's so much what we try to do in dentistry is prevention. And absolutely, I think a lot of medical care has been treatment-oriented, but they're getting more and more into prevention as well.
Yeah.
So
anyway, it's been a pleasure talking to you. And
Dr. Rudy, thank you so much.
You're very welcome.
Being with us.